my name is Megan Harrington. This is my head-to-toe final test out for Nursing 513. First, I'm going to start by talking about the general appearance of my patient. My patient appears to be well-developed, well-nourished, and well-groomed. She is cheerful and she is dressed appropriately for the season. She is in no acute distress. She moves all extremities well and has good posture. So now I'm going to ask you a series of questions. So first, can you tell me what year it is?
2014.
And what month is it?
August.
What season are we in?
Summer.
Okay. I'm going to tell you 5 words, and I want you to put those away in your memory, and I'll ask you them at a later time. Car, house, dog, ball, flower. Okay, and what is 5 plus 6?
11.
Okay, and can you start subtracting from 100 by 7?
193, 86, 79, 72.
Okay, good. And what were those 5 words I told you?
Car, house, dog, flower, ball.
Okay, and what's on my finger here?
A ring.
Okay, and I want you to read this and do what it says.
Close your eyes.
Okay, good. And one last silly question. What would you do if your house was on fire?
Call.
Okay, so my patient is alert and oriented times 4. Her speech is clear. Her thought processes are coherent. Her calculations and remote memory are intact, and her insight and judgment are normal. So now I'm going to assess your head, basically. So I'm just going to come around here, just feeling your scalp for any lumps, deformities, depressions, masses, and making sure everything looks symmetrical, checking your hair distribution, making sure that it's normal for age and ethnicity. Now I'm going to look at Morgan's eyes. I'm going to first just inspect the sclera, the cornea, and the eyelashes. So if you can look up for me. So what I'm looking at is her sclera, making sure that it's white, and the vascular pattern in her eye. Also the conjunctiva, making sure that it's pink, moist, looking for any lesions, drainage, any lumps beyond there, and same thing on this side. And making sure that her eyelash pattern is normal and evenly distributed. Now I'm going to test your pupil's reaction to light. So I'm going to shine my light into your eye. Look straight ahead. And this tests cranial nerve 3, 4, and 6. And what I'm looking for is a constrict reaction in the eye the light is going into, and then a consensual reaction in the opposite eye. It should constrict, but maybe not as much. And making sure that it's symmetrical. Her pupils were equal, round, reactive to light. And then I want you to look at that picture on the wall. And now look at my finger. And that's accommodation. The pupils should constrict when they move from a from a distant object to a near object. Now I would test her visual acuity. So I would hand her a Rosenbaum chart, and that would be for near vision. She would hold it 14 inches away from her face. I would have her cover one eye at a time and read the smallest line she could see best. Then I would do the distance chart, which is the Snellen chart. She would stand 20 feet away from that, cover each eye, and read the smallest line she could see best. And that tests cranial nerve 2 as well. Also with my pen light, I would check her red light reflex. So I would use my right eye up to her right eye, and I'm looking at her retina to make sure that I'm seeing a red color reflect back at me. That's testing cranial nerve 2. Then the wiggle finger test tests for peripheral vision. So I want you to tell me when you see my fingers out of the corner of your eyes.
Yep. There. There.
Okay, and that also tests cranial nerves 3, 4, and 6. And then last we're going to do extraocular movements. So just follow my finger with your eyes, not your whole head. Okay, good. And what I'm looking for there is symmetrical eye movement, no nystagmus, and no eyes drifting off into a different plane. That's testing cranial nerves 3, 4, and 6 as well. And then we would do the cover-uncover test, which tests for strabismus. So what I would have you do is cover your right eye with your right hand and uncover. And what I would be looking for is to see if the covered eye would jump back into place when she'd uncover it, and that would be an indication of some sort of weak eye muscle. And then do the other eye and uncover. Okay. All right. Stop.